Hello, my name is Phelan Bailey. Today I'm going to be discussing my plan to reduce the prevalence and impact of pediatric obesity in rural eastern Kentucky. The purpose of this project is to determine the benefits of a structured nutrition and physical activity educational program on reducing the body mass index of obese school-aged children. So over the past 3 decades, the rate of pediatric obesity has tripled for the ages of 6 to 11, and the rates have doubled for ages of 12 through 19. Currently, nationwide, we are at a rate of about 18% of children being categorized as obese. When obesity occurs at this young of an age, there are many long-term effects that are seen that are typically just disease processes associated with adults, such as hypertension, dyslipidemia, and diabetes. Other effects that are commonly seen can be depression or other mental health disorders that are based on a poor self-image. The Institute of Medicine recommends that primary care providers screen the BMI and offer health education and counseling for children and their families. But I think that healthcare providers, specifically nurse practitioners, can do a lot more for these children, such as providing them with that consistent, structured education related to nutrition and physical activity. After an extensive literature review, it was determined that the most beneficial and practical way to improve these children's outcomes is to provide them with that nutrition and physical activity education in the school setting. They're already primed for learning, and that is a very good setting to be able to get them to sit down, listen to material, and really absorb it. Researchers have found that providing that education in the school setting leads to a decrease in BMI and offer the benefit of great retention since they're already there. Other researchers have found that providing these children with an individualized education over a span of several months leads to decreases in BMI as well as the decrease in prevalence of hypertension and hyperglycemia. Great. My project will take place during the fall semester of 2016 in one or several of the Round County schools, depending on where the obese children happen to go to school. With the help of the school nurse of each of the participating school, about 10 or 12 children will be selected. They will be school aged between the ages of 5 and about 17, and they'll have a BMI that is greater than or equal to the 95th percentile for their age. After selection and consenting is complete, the participants will engage in weekly educational sessions that will cover how to make healthy nutritional choices and the benefits of physical activity on their short-term and long-term health. During the first and final visits, the participants' age, height, and weight will be collected, and at conclusion, the pre- and post-intervention BMI percentile will be compared for any significance. In conclusion, this intervention could have many positive benefits, including decreases in BMI, increased physical activity, decrease in daily caloric consumption, decrease in sugary drink consumption, and decreases in prevalence of hypertension and hyperglycemia. These benefits could be seen with minimal monetary involvement, and retention can be positively affected by integrating this education into their daily school routines. If the goal of this project is met, then hopefully children can see what effects the choices they're making are having on their body and what they can do to improve their health by making meaningful changes. Thank you.